Hi, for those who don't know me, my name is Brenda, and today I'm here to do a presentation on effective procedures and measures that we could put in place to calm escalated or aggravated patients on our psychiatric unit to minimize the use of physical or chemical restraints. First, I want to look at the setup of the unit. We want to make sure that it's being conducive to our patients' needs and has a vision of recovery-focused care. This includes creating a quiet room to decrease stimuli or a designated area outside where patients can retreat with staff if they would like to get outside and get some sunshine and fresh air. There needs to be a calming color that is painted on the wall. Noises need to be soft and quiet. There needs to be movable furniture and exits for both patients and staff, and also detailed pass-ons or reports nurses do, so that way they are aware of what the patient's specific triggers are and what interventions they need to put in place for that patient. Then, since I've talked about the unit, for all the staff to be equipped to work on that unit, there should be mandatory training. The mandatory training should be on de-escalation techniques using verbal and nonverbal techniques. According to Richmond and Western Journal of Emergency Medical Clinics in emergency settings, also will need to be skilled at recognizing the inability to conform due to cognitive development. For example, if a patient has delirium, an intellectual disability, or psychosis, they don't know how to reason or calm themselves down. So staff needs to know how to handle those situations and what types of interventions they need to do with those specific patients to keep the patient safe as well as staff members. It supports the rationale for mandatory training. According to Tishner, there's been several studies done that the link between those mandatory trainings and de-escalation have actually showed a decrease in violence on the units. So I think it's very important that all staff members from dietary on to the physicians are trained in how to effectively de-escalate these patients and adequately care for them. Some other statistic factors that lead to possible escalation or violence typically happens with young males, males that have autism or anything on that spectrum, any other neurological impairments, sometimes people who have traumatic brain injuries. So it's very important for all staff members to be aware and know how to handle these patients. So please take into consideration so we can make these changes to our unit and with our staff so we can provide quality of care for these patients in need. Thank you.